All right, welcome everyone. Thank you all so much for joining the Smoke Free Native, Empowering Native Communities to Quit Commercial Tobacco through Culturally Tailored Texting webinar. We are so happy to have you all join us. This is an exciting time to touch base on a very groundbreaking initiative. We would love to welcome everyone joining. And as we're getting ready to start, we would love for those of you who are here with us to let us know who you are, your organization, and one thing that you're looking forward to joining today. So thank you so much. So today we are joined by four incredible panelists to discuss the Smoke-Free Native Texting Program. Together, they're going to discuss the innovative Smoke-Free Native initiative that empowers Native communities to quit using commercial tobacco through culturally tailored texting interventions. You'll also gain valuable insights into this transformative approach to promoting health and wellness in Indigenous populations. And as you're listening in, we would love for you all to be mindful as you learn more about this program, thinking what would be helpful in sharing this information with your communities, your clients, or any partners who are looking to end up ending quitting using commercial tobacco. And also, I think this is just a really exciting time as we are tuning in to show just the incredible approach when you are doing relationship building, creating partnerships, and doing things in a culturally based way. And so this is something we're super excited. So I would love to introduce you to our panelists that we have on the webinar today. The first is Alberta Basenti, who is an enrolled member of the Navajo tribe and currently serves as a public health advisor for the Health Promotion Disease Prevention Program and acting consultant for the Health Education Program with the Indian Health Services Division of Clinical and Community Health Services. Our next panelist after Alberta will be Meredith Grady, who is a public health advisor in the Tobacco Control Research Branch at the National Cancer Institute and has served on the smokefree.gov initiative management team since 2014 and began co-directing this initiative in 2018. Next, we'll have Dana Carroll, who works for the University of Minnesota School of Public Health and is an epidemiologist and certified tobacco treatment specialist committed to achieving health equity through reducing commercial tobacco use. Her research leverages multiple methodologies, including analysis of large epidemiological surveys to qualitative research and clinical trials, and often entails community-based participatory research. Over the past several years, she's had the opportunity and privilege to collaborate with tribal nations and community organizations serving American Indian persons on projects aimed to understand what works to increase smoking cessations among American Indian persons. And then finally, we'll be having Wyatt Pickner, who's Hunkpati Dakota, who is the Research and Evaluation Manager at the American Indian Cancer Foundation. And so we're extremely excited to have this very esteemed panel sharing about all of the intensive journey that this program went. So first off, we're going to turn it over to Meredith Grady.
Okay, thank you, Coco. Hello, everyone. Good afternoon. I'm Meredith Grady, and I'm so excited to be here today to talk about Smoke-Free Native. It's been a really exciting collaboration and just personally very rewarding to be involved with. So let's get started. Next slide. I thought I would tell you just a little bit first about the smokefree.gov initiative. Can we go to the next slide? Thank you. So what is the smokefree.gov? So Smoke-Free began in 2003 as a website, and we just celebrated our 20th anniversary last year. And as the digital landscape has changed, as devices have changed, so too has smokefree.gov. And it has evolved to become this suite of web and mobile-based smoking cessation resources that are meant for, people who are ready to quit smoking. So we are not a prevention initiative. We're really focused on intervening with people who are ready to try to quit. This varies year to year, but in general, we reach about 7 to 8 million people every year. All of our resources are evidence-based. We rely on information from the clinical practice guidelines, the Surgeon General reports, the Cochrane reports. So all of our resources are evidence-based, and they're all freely available to the public. There's no cost to enroll. Although, I mean, if you sign up for a text message program, there could be a cost. So just to tell you a little bit about our resources. So like I said, we started out with the smokefree.gov website. We now have 5 satellite sites for specific populations. So there's a smoke-free teen. We have a site for veterans, for Spanish speakers, for women, and also older adults. We have smartphone apps. We want to give people choices in terms of the kind of resources that they want to use to quit. So if they want to use something interactive, like an app where they can, track their cravings, track their locations of where they have their cravings and get on-demand support, they can do that. We also have our social media accounts to help connect people who are trying to quit. It's also useful to help people who have been successful in quitting, like share tips and resources to help people who are in the quitting process. And then we have these text-based interventions. So back in December of 2011 is when we originally launched the Smoke-Free Text program. And we have since, added several more. I think we have about 9 text programs now. Our resources are there for adults and teens. And so if we can go to the next slide. Oh yeah. So the Tobacco Control Research Branch at NCI manages the program, but we are really represent a collaboration across HHS. We receive funding support from a number of different agencies, including FDA, CDC, the VA, and also since 2018, the Indian Health Service. So we started a partnership with them back in 2018, about the time that I took over in helping to direct the program. And what we created was a tailored version of smoke-free text called Smoke-Free Text for Natives. And I think Alberto and I would describe it kind of the same way. It's a lightly tailored program. It allowed people to still access the core evidence-based cessation content in smoke-free text by using a keyword, texting native to 47848. And then that allowed IHS to have some of the engagement metrics and enrollment metrics about like how many people were signing up, what were they doing, when did they opt out. And so, after a period of years, so I think beginning in early January, Alberta and I were talking, and it was really nice. It was an opportunity where we thought, well, we want to plan for our next year, and what do we want to do? And so next slide, through the conversations that we had, thank you. We decided that we wanted to build a new text resource. And we had one, and it was good for a lot of reasons, but it was really lacking the cultural context that we would like to see in a program. And we felt like something that was a little more robustly tailored would be resonate more, be more salient for people who wanted to use the program. But then it also could be something that we could have live on smokefree.gov and be more visible for people. So the idea was to develop a new smoking cessation text message program that represented, that was evidence-based, used smoke-free text, was accessible, all those things we had before, but really that cultural alignment was the new exciting aspect. Next slide. So I reached out to Dana Carroll at the University of Minnesota, and I kind of knew about her work a little bit already. She had been working with through a grant on using one of the SmokefreeNATIVE apps and tailoring that for Native American communities. So she was really a natural partner to be involved in this. And, you know, in reaching out to her, she brought in Wyatt, ACAF, and also the community advisory board that they use. So, you know, I feel like something happened that doesn't normally happen, and like all the stars aligned, and you know, IHS and NCI were able to, you know, find funding for this, you know, provide the subject matter expertise, both with the community and also in cessation, and then, you know, come together with these great partners to work together to create this program that you'll hear much more about from Dana and Wyatt. So, but this is kind of I just wanted you to see sort of the overall group that was involved. Next slide. So just a couple details about Smoke Free Native. It's live. It launched on December 14th. It's publicly available to anyone who wants to use it. There's a couple ways you can enroll. There's a web form on smokefree.gov that allows you to, you know, quickly answer a few questions and get enrolled in the program. It's also easy to just text the keyword Native to 47848, and then, you know, it would be immediately enrolled in the program. So, like Smoke Free Text, it's a 6 to 8 week program. So it's a 6 week intervention, and someone, depending on the quit date that they can choose, can receive up to 2 weeks of prep messages before their quit date. It's free, as I said, I mentioned before. So all of our resources are free. With text message programs, though, depending on someone's data plan, it could be that data or message rates could apply, but there's no charge for the program. It is tailored for adults and teens. The content is very similar, but there are you know, a certain proportion of messages where we have thematically made the content the same, but you know, there is a difference in the messages for adults versus teens, and we also in the teen program do not offer cessation medication messaging, so that's a core difference there. So next slide. I'm just going to give you a really fast run through of our project overview, and then I'll be able to hand it over to Dana, and then she and Wyatt will get into the really interesting work that they conducted. So as I said, you know, we initially started these conversations with IHS in January. We're able to pull everything together and get it in place to start in October, which for government is incredibly fast. So we kicked off the project with Dana and her team, Wyatt and his team, and our ICF Next contractors. And then, you know, ACAF and UMN really spent some time taking a look at Smoke Free Text, coming back to us with some recommendations on how the program could be developed different in a more culturally aligned way. You know, worked over the winter on developing some of the messaging, and then brought in their community advisory board for some input, which I'm sure Dana and Wyatt will talk about. By the summer, we had a full research version of the library available. We applied for and received IRB approval. And then in the summer and fall, their teams were conducting iterative testing on this research version of the library, and, you know, followed by, you know, incorporating, feedback from the testing, as well as like further refinements. And as I said, we were finally able to launch right before Christmas in mid-December, which was really helpful to kind of like have this new resource be out there, like right at the beginning of that sort of resolution timeframe at the end of the year when we traditionally see that there's like more interest in cessation and making a quit attempt. So I will stop there and pass things over to Dana.
Thanks, Meredith. And I think actually Alberta was able to join. And so we're going to have Alberta kindly go after Meredith now, and then I'll pick up after you, Alberta. Alberta, you're still muted. Well, I'm not oh, there we go.
Okay, good afternoon. Thank you for inviting me to this presentation. I'll go ahead and get started now. The next slide, please. Okay, just to give you some background on Indian Health Service, Indian Health Service actually provides a comprehensive health services program that serves 2.5 million American Indians and Alaska Native, and that's through 600 hospitals, clinics, and health stations. And it provides services to 574 federally recognized tribes in 37 states. Next slide, please. And then these are actually a map of all the areas that we serve, the administrative area offices, and then I'll also have area health promotion disease prevention coordinators in each of the 11 areas. And each of the area coordinators work with the tribe's urban and IHS program to provide tobacco prevention services, and then also to refer and link patients who are ready to quit with services as well. Next slide, please. Just to give you some background, there is significant health disparities among American Indian Alaska Native communities, and then these include heart disease, cancer, and diabetes. And many of these health conditions and diseases are related to lifestyle behaviors, especially physical inactivity, commercial tobacco use, and poor diet. Next slide. So we have to make sure that we also define what is traditional versus commercial tobacco. So anytime we're talking about tobacco use, we're talking about commercial tobacco use. So this is where traditional tobacco use is the sacred or ceremonial use for religious or medicinal purposes, or commercial tobacco use is for recreational and habitual use. Next slide. So when you will look at our data that are available, and you can see based on the slides, when you look at the past month cigarette use among adults by ethnicity, this slide shows the American Indian Alaska Native use cigarettes 30.7% in comparison to other ethnic groups. As you can see that they use a lot of commercial tobacco cigarette use. Next slide. And then when you look at it by American Indian Alaska Native adults by region and gender, there is some regional differences. And when you look at the Northern Plains for both men and women, the cigarette use is over 40%, and then it's followed by Alaska and East. And then as you noticed in the Southwest, it's actually, they don't use as much tobacco in comparison to other regions. Next slide. And then when you look at youth, this is actually the 2019 National Survey on Drug Use and Health. And when you look at any tobacco use among middle and high school by ethnicity, again, you look at non-Hispanic American Indian Alaska Native population is at 13.5%. and then which is higher than any other ethnic group. Next slide. These are concerning because you know that commercial tobacco use increases risk for cancer. And then when you look at cancer by rates of new cancer cases among American Indian Alaska Native, you can see that when it comes to lung cancer, it ranks second both for men and women. And then the risk factor for lung cancer is commercial tobacco use. Next slide. And then when you look at the leading causes of cancer death among American Indian Alaska Native male and female, again, the number one for men and for women is lung cancer. So this indicates that we really need to go focus on commercial tobacco prevention in order to reduce some of the risks that contribute to lung cancer. Next slide. And we're always looking for ways to actually increase access to tobacco cessation program, especially for those people, individuals who are ready to quit. And so we're looking for other partners who would be able to help with this to make it more accessible for American Indian Alaska Native population to be able to provide cessation services and some resources for them. So then we talk with the National Cancer Institute and be able to create this collaboration on SmokefreeNATIVE. So we developed this interagency agreement back in 2018, and the first rollout is rolled out in 2018, and then but was follow up with further text messaging, which is going to be described by our next speaker. I'll go ahead and go turn it over. Thank you.
Great, thanks so much, Alberta and Meredith. It's wonderful to go next, and exciting to share a bit about the journey that myself and then my close collaborator Wyatt Pickner were on. That, as Meredith mentioned, it was just really like the perfect scenario with we were all, you know, at the right place in the journey, and we're able to make this possible. So I'm going to talk to you a little bit about some of the qualitative or formative work that was going on that essentially led Wyatt and I to be at a good place to help with this project. Okay, thank you. And just as a disclosure, the research I'm going to be talking about today, we did get some funding from the National Institutes of Health. Next slide. Great. And I just wanted to mention this. I am at a university, and I understand that the land that I reside and work and live on is the sacred land of the Dakota people. This is actually a photo of my husband and daughter, and you know, we're in the state of Minnesota where the water reflects the sky. And so I always want to do all that I can in my research, my teaching, my community engagement to help rebuild trust with the communities that have justifiably lost trust in academia in the university settings. And so hopefully some of the work that you see today will exemplify my commitments. Next slide. Okay, so as Alberta was sharing from her perspective, and then Meredith from her perspective on why they were part of this effort and their rationale, we also had similar and really complementary rationale. So I will say, prior to working on digital resources, I had the privilege to work alongside some American Indian urban communities, as well as tribal nations. And one particular project involved me coming alongside a past tribal councilman and helping his tribe and clinic implement a in-person smoking cessation curriculum that did two things. One, it restored, and the goal was rebuilding the use and knowledge of traditional tobacco. And then the other component was layering in support to help people quit commercial tobacco. And it was just this really beautiful example of like braiding different approaches together. What has been coined by Indigenous scholars as the two-eyed seeing approach of really bringing together Indigenous ways of knowing, culture, assets, along with some of the Western approaches. For example, how to track smoking triggers, how to be prepared when you have a craving. And so it was a really exciting program that has been pretty pivotal in the work that I've been doing. And, you know, I learned a lot. And one of the things that we heard from our participants in that study was, while this is great, transportation to the clinic for the in-person curriculum, as well as finding a time that worked for everybody, obviously has its limitations. We're all busy. And I think that that was really echoed among the participants. One particular participant said, you know, we really should have some other resources that, even if we come to this, can kind of wrap around us out in the real world. And so had put forward their interest in digital smoking cessation resources. This experience was not just ours. I think this is probably true with a lot of different programs that are put on for public health. And we also saw in the literature that there had been some prior culturally aligned curriculum. And when they went to evaluate it, there was loss of follow-up when participants were required to show up weekly over time. And so certainly our experience was not unique. And also, we know, as mentioned by Meredith, digital resources have really unique advantages. They can be readily tailorable. They're at arm's reach. Today, in today's world, I just looked up some statistics on smartphone ownership. We know among this particular survey, about 87% of American Indian persons report having a smartphone. And so while it's not that everybody has a smartphone, the access to this resource is quite high and allows for access to digital resources that include certainly text-based programs, as well as apps, and even going online. Next slide. Great. So I'm going to share some of the story behind this publication, and I will, in a few slides, show you a infographic that we developed as part of our dissemination of this research. And it's really the commitment not just to have our research land in a scientific journal that maybe not many people will find or be able to read, but to also share our results back in engaging ways with community. And so there is a free resource on this that I'll share. Next slide. Great. So we essentially sat down as part of some funding that we got from the National Institutes of Health. And we asked a very, simple question, which is, let's take some existing digital resources to the target audience that we want to help develop digital resources for, so American Indian adults who smoke. And we also did some interviews among public health professionals that were really working in the space, as they were either tribal tobacco treatment specialists. Some folks in that group were really leading some of the efforts around the traditional tobacco movement. And so we had that stakeholder group as well. And we presented them with a current smoking cessation resource. This actually happened to be an app, a smartphone app, but what we learned on how to culturally align a smartphone app developed for the general audience was, as all mentioned, we were able to transition and pivot that knowledge that we learned and we received from our participants into the text-based program as well. Next slide. Okay, this looks even smaller than I had hoped. So I just wanted to briefly acknowledge the participants that we had in our study. So we had 40 American Indian adults who smoke, and they expressed interest in quitting. And here's just some background of those folks. And so on average, they were 42 years of age. We had slightly more females than males in our study. And you can see some of their other characteristics. We asked them a traditional scale. We asked some questions on their traditional practices. So you see about 90% reported offering tobacco in a traditional way. We also acknowledge that we understand that not all tribes have the same connection to tobacco, and some tribes don't have that connection to traditional tobacco. And so I just wanted to mention that this was common in our sample, but I think what Wyatt will do in his presentation is really make a nod to us trying to make this a inclusive program as much as possible, while also aligning with the needs and interests of the participants. Next slide. Okay, so this is some of the main results from what we learned from our participants. And again, we basically showed them examples of an app that was developed for the general audience, and said, ask simple questions. What's missing? What do you like? How can we improve this? And as an aside, that app is currently being used for research purposes, and we're hoping to do some longer term evaluation of that. So that one's not publicly available like the text-based program is. I'll go through each of these domains in some greater detail so you guys get a better flavor of what we learned. So next slide. So one of the questions and ways we summarized the data was, what were some barriers to quitting? And that was helpful because we know that if people can start tracking what causes them or triggers them to smoke, there can be some mindfulness there. They can start to plan to either avoid those triggers, or they can learn to help mitigate those triggers in various ways. And so we received received a lot of wonderful, rich feedback. A lot of triggers that are certainly not unique to the American Indian population. Triggers like stress or depression, seeing other people smoke, for example, rose up. And so what we further asked were, what are some triggers that you don't see here, but that you experience in your day-to-day life? And certainly in our sample, we observed that a common theme that was not having access to traditional tobacco and using commercial tobacco, either in its space or feeling that it wasn't respectful to not use the commercial tobacco that was there in lieu of the traditional tobacco because of that complex history there. Also, what came forward was grief, experiencing loss of family members, even loss of land, and trauma. And so I will mention that this also, our interviews happened, we did them during the pandemic. And so I think loss and grief was even amplified more during those times for many of our participants. But this theme really, I think, resonates with a lot of other programs that we've looked at that have been implemented, before the pandemic as well. Next slide. We also asked, we wanted to know what has worked to help you quit, as a nod to thinking, how can we infuse some of these, really strength-based approaches. We didn't want to just learn about smoking triggers and so we could track them better, but also what can we put into a program or infuse into a program that will help people quit or avoid, relapse. And so a common theme that came up was community and cultural connectiveness. And I'll actually read this quote. I think being in community is really healing, whether it's gathering or a talk or something that's offered to us. I feel like I'm not so lost as I was before I found and embraced Native spirituality. And so it's just really this idea around encouraging connecting with one's family, with one's culture, learning about their culture, that, as Wyatt will share, we did our best to try to infuse into a digital resource. And certainly I can't leave out the smoke-free policies piece, and just that this was brought up by our participants, that it was a promoter for smoking cessation. Next slide. So along the similar lines that we've learned about, we also learned from our participants this desire to really live in a traditional way, to get back to how tobacco was supposed to be used in their culture and in their family. And so that was a really, a beautiful theme that that resonated, I think, with a lot of our team members. Certainly, we also heard about not so much about quitting for me, it's quitting for the next generations, it's quitting for my family, my community. And so I think when we see a lot of smoking cessation related language, it might say quit for yourself and your family. And what something simple is what we learned from our community advisory board is thinking about quit for your family and yourself, right? Switching the order because of the value that is placed on that. Next slide. So other elements that surfaced that we heard were, this idea that, smoking triggers can happen. And so what can we do to really get people to stop thinking about that next cigarette in the moment? What can we do that infuses some of the cultural activities that people would like to learn about? And so what surfaced were some different ideas from participants, such as encouraging participants to dive into beadwork, traditional crafting, or really any type of activity that they can use their hands. And then certainly we heard from a lot of participants that often programs are portray tobacco as entirely negative, and don't make that distinction that Alberta shared about of the difference between commercial tobacco being what they're there to quit, but also respecting traditional tobacco and perhaps even reclaiming traditional tobacco is where some people were at as well in their journey. And so we really wanted to infuse that into the digital resource as we learned from our participants. Next slide. So as I mentioned, we also heard from our esteemed public health professionals, and there were amazing thoughts from them. So a lot of constructive, but also, very real. So, this needs to be convenient. Any program, break down as many barriers as you can. So something as simply as texting a number to enroll in is like fantastic versus having to go through more hoops. Also, what was really echoed and something that I hope that you will see is exemplified by this effort put forward is that it cannot be done in any other way other than a participatory approach. And so that is, I think, so integral to everything we've done and why we hopefully foreseeing that the Smoke-Free Native program will have such an impact, because not only did it start with voices like those that I'm sharing here, but we had a community advisory board that came together for an entire day in the cold month of January in Minnesota, and they poured over the example messages and Wyatt will talk more about this. And so we knew that it was the forefront and making sure that it was a collective and centering the participants. And then we embarking on this work, I will say there was the tension, and this is something that's still pretty center to everything that Wyatt and I have been thinking about. While doing a program for one clinic or one community or one tribe, there's certainly heterogeneity even within culture and families in that setting. Making a resource for a national audience of American Indian persons is it's the heterogeneity in cultures and rich backgrounds and relations with commercial tobacco, with traditional tobacco, are not small by any means. And so throughout our efforts, we always strive to make this a place of a sense of belonging for people that was inclusive. And hearing from our public health professionals is knowing that it was created for American Indian people in mind, and it was aiming to be inclusive is better than the current general audience resources. And so we felt like our public health professionals were really alongside us and thought that this was okay to move forward with a national target audience. Next slide. So as I mentioned, we strive to put everything in an infographic that you folks are can access and download. And so I actually have this on one of my research websites. If you would like to see it, you can email me, or we can figure out if you put your name in the chat, I can follow up. But essentially, we took all of this really rich knowledge and tried to put it in an asset-based way. So what did we learn that really promotes smoking cessation? And I apologize, it's so small, but what we also did is we hired a graphic designer from within the American Indian Cancer Foundation to really make this engaging versus, you know, something that looks like I did, and it's not that beautiful. So as you see here, we took those learnings and you see them around the quitting smoking. And so promote ways to heal and address grief and trauma, providing access or encouragement to learn and access traditional tobacco. And so all of these themes I just shared are put around this. And again, trying to make them in an asset approach is how we did it. And that is something that one of our community partners really encouraged, like, let's frame this in a positive way. Next slide. Okay, this is my last slide, and then I'll pass it over to Wyatt. So certainly, there have been larger efforts around similar themes of, you know, trying to prevent or treat substance abuse. And so we looked into the literature as well. So we heard from our participants, we wanted to prioritize their perspectives, but we thought, well, what else is being done in this space? And so a curriculum that I'm sure many here are familiar with is the Gathering of Native Americans curriculum. And this was developed in part by SAMHSA in collaboration with community. And it's a strength-based process that seeks to prevent and reduce substance use. And it leverages throughout its teachings and exercises 4 worldviews. One is belonging. So creating a sense of belonging in the program through connecting with others, connecting with culture. Another worldview is mastery, so teaching folks how to be empowered and overcome their substance use. Independence or resiliency, that, you know, you are strong, you are every try counts, you keep going. And then generosity, so giving back. And Wyatt will share with you, essentially everything we did and all of our learnings, what we tried to do was see how well we aligned with these worldviews. And for example, if we felt like, you know, we developed tailored texts, but not many hit on generosity, we revisited that. So this was a way to kind of see how our cultural alignment efforts were going in alignment with this curriculum. So with that, I think, Wyatt, you are next.
Yes, hello everyone. It's great to be here with you all. Again, my name's Wyatt Pickner. I'm Hunkwati, Dakota, originally from Crow Creek, South Dakota. And as Coco mentioned, I'm the Research and Evaluation Manager at the American Indian Cancer Foundation. So building off of the information that Dana was just presenting, we wanted to provide some examples of, you know, how we took those various worldviews and those themes and what it looked like to incorporate those into this project. You know, we really wanted to have a lot of intentionality put into the work that we were doing because, you know, while this is a text-based program, we didn't want participants to necessarily feel like they were just talking with, you know, an automated program. And so part of the way that we approach this as we were developing, you know, these messages and all the components of it, you know, we want to make sure that, and we're going to continue to work on this through our promotion of the project, is, you know, there is a whole community of people that are here to support, you know, the users in their quit journey. So it's not just, you know, an automated message system that is, you know, giving you some of this advice. This comes from, you know, community members out here that really do wish you the best in this journey and providing that support and encouragement and strength and inspiration to keep going on that journey. And so these are some of the components of, how we culturally aligned some of that content and how it matched up with the Gona worldview. And so within mastery, there's education on preparing for American Indian smoking triggers, including, like Dana talked about, feeling grief or experiencing loss, being around commercial tobacco at traditional and ceremonial events. Mastery and belonging related to education on and promotion of healing from historical and intergenerational trauma through breathing, mindfulness, and connecting with one's culture. Belonging, again, this is one of the things that we really wanted users to feel welcome, and that this is where they needed to be, and that they felt comfortable using this service. And so promoting that, living in a traditional way, and promoting sacred tobacco use, connecting with creator, and clarify when tobacco is being referred to as commercial versus traditional. As well as addressing beliefs around cessation medications and help to promote NRT or nicotine replacement therapy use. And messages like, do you desire to live in a traditional way? Quit medications like nicotine patches and gum can help get you there. In addition to that, there's a couple others on interdependence. So culturally aligned inspiration, such as, who do we live for if not for the next generations? Quit smoking for them, and seeking guidance from a spiritual or traditional healer can help you quit. Another one on interdependence and generosity, greater emphasis on encouraging quitting for one's family community versus one's own health and ability to give back to their family community due to money and time saved from quitting smoking. So those are some of those specific worldviews and the ways that we were applying those. We'll provide some more examples of what that actually looked like in the tailored messaging here in a few slides. The other thing I wanted to highlight is so the work that we do here at the American Indian Cancer Foundation. If you're not familiar with us, we are a national nonprofit that was established to address the tremendous cancer inequities Native communities are faced with. And we have a mission to eliminate these burdens through education and improved access to prevention, early detection, treatment, and survivor support. We strive to be a partner trusted by tribal and urban community members, leaders, healthcare providers, and others working to create effective and sustainable cancer solutions. We believe Indigenous communities have the knowledge to identify and develop solutions to the problems they're faced with, and are often looking for the support and resources to make those solutions a reality. And I believe that this project is a perfect example of our approach, our mission, the values that we have here, because as Meredith and Alberta and Dana have talked about, they recognize that there was a need within our communities to develop a more appropriate and tailored resource. But there was that struggle to come up with how best to create content and information that's going to be relatable and useful and beneficial and well received by the users. And so instead of trying to figure out how to do that on their own, they went to community partners who have good relationships with specific communities that we've been doing work on tobacco, traditional versus commercial, and how to approach some of that. And so again, I think the presentation that Dana just did around all of the background research, we wanted to present all of that because while the initiative to tailor the smoke-free text program for this population was fairly quick, we've been doing research on this topic for several years now. And so we wanted to make sure that we communicated, all the work that went into being able to be prepared to develop this content fairly quickly. So we had a really solid foundation and information to go off of that was rooted in the community perspective and the content and information that American Indian Alaska Native people who were looking to quit smoking were looking for. And so that's what all of this work is really based on. Jumping into the actual smoke-free text program or smoke-free native program development, as Meredith highlighted at the beginning, she showed kind of that roadmap that we went through. And so within that, more specifically, the first step that the project team at ACAF, in collaboration with Dana, we started by reviewing the original text library, looking through the structure and the format of the messages and what that looked like. And so again, Meredith presented some of the details here where it's a 6 to 8 week program, depending on when someone's ready to quit, and then some follow-up as well. And so this kind of just like gives you a high level overview of what the full program structure looks like and the timing. And so then you also have keywords and a varying schedule that includes pre-intervention or your pre-quit date, so preparing you to quit, and then 6 weeks of going through the program itself, and then follow-up messages to check in and see how things are going, including if you need to restart the program as well. So some examples of what things look like in the original library. Again, there's a pre-intervention message and some examples of what that looked like, the intervention message, and then some of those keywords. And I'm going to show some other examples of, here's what it looked like in the primary original library, and then how we took that and what that tailored version of that message looks like. And so, basically what's showing here on the screen is, the initial message to ask about, the library will ask about, cravings, mood, and smoking status. And so, one day it may say, keep your mouth busy with mint, straws, or gum to help curb cravings. What's your craving level right now? And then you can reply with high, medium, low. And based on that, then you would get an additional message that kind of helps respond to that in a way that can provide additional information and resources to address that craving or the various mood or smoking status. So then, yeah, the again, as we were looking through the various components or features of the program, we started talking about the keywords, and we kind of went back and forth about did we want to switch them, did we want to change them? And I think one of the key things that we didn't want to do a whole lot of was changing the foundational components of the program itself. And so we elected to keep the crave, mood, and slip keywords that were part of the original text message library. And so again, crave is around, when a user is having a strong craving and needs a reminder on how they can, stay quit and not give in to that craving. Mood is when a user is having a bad day or is, in some type of mood and just needs some encouragement or some support to keep them from smoking. And then slip is, if a user has slipped up and, has smoked commercial tobacco, and from then, based on their response, they can either continue in the program as planned, or they can restart the program as well. And so then there's ways to engage with that. In addition to that, part of our tailoring was that we wanted to include content that was more relatable and relevant for Native communities. And so we went through a process where it was kind of a interesting way to go through and look at the original keyword phrases or keyword statements. And some of them we transitioned and tailored. And other times there wasn't necessarily an equivalent of that in the original library. And so we started to think about, what are the concepts and the things that could help people quit and stay quit. And again, thinking back to the research that had been done previously and all the results that we had, we came up with the idea of 3 additional keywords. So in the tailored library, you have the crave mood slip. You also can text mind, honor, and connect and get messages or phrases that relate to these concepts. And so for mind is really around mindfulness. So the user can text to help find balance in their day. It provides encouragement and suggestions on how to do that. Honor is the user can text to learn more about Native culture, including traditional tobacco. One of the really I guess, creative ways that we wanted to try to make this as inclusive as possible was including, what the traditional word for tobacco is in a variety of different native languages. And so we gathered some of that feedback from people as well to try to have that as a teaching tool as well, because we know that, that education can also be encouragement to or a cessation approach of like learning a new skill and encouraging people to go down that avenue instead of smoking commercial tobacco. The third one is connecting. As Dana mentioned, in our results, there was a lot of information around the kind of support and encouragement from friends, family, community in wanting to quit commercial tobacco. And so those messages really relate to, maybe you just need a reminder of, reaching out to your family member, your relative, or someone that helps to kind of ground you and remind you of your the reasons for you quitting. So again, some different ideas on how to do that. And so through all of that, after we reviewed that initial structure and the primary library, we drafted a full tailored version of the content, but we knew that like we were only a few voices and we needed to hear more from other people, especially from, around the country, knowing that many communities have their own knowledge systems and protocols and practices with tobacco, and wanted to make sure that we were trying to include those voices in this content as well. And so we recruited a variety of different people from around the country that represented different tribal nations and communities to try to be more inclusive and think, what else are we missing and how can we update and improve that? And so we had 8 people that agreed to participate and provide guidance and expertise on the project. And as Dana mentioned, we brought them all to the Twin Cities in Minnesota here in the middle of January, which somehow things aligned and we were able to make it happen without too many travel issues or weather issues. And so during that all-day meeting, we walked them through the drafted, tailored content and asked for their feedback on that to see if those were messages that aligned well and if they felt that those would be accepted within the communities that they were part of, or just like how well that was fitting, or if we've just completely missed the mark. Again, we asked for feedback of how to be more inclusive and, messaging or phrasing that maybe specific communities have and how we could try to include that. And then we were like, maybe there's something we're just completely missing. And so what new ideas, thoughts do you have? I remember one specific prompt that we had was, what is a piece of advice that you would want to give to one of the users? And we were like, everything from serious and really intentional around like, we're here to support you on this journey, to, humor, because that is, I think within Native communities is a strong approach to being successful and being relatable in a lot of this. I think for me, laughter and humor is a medicine as well. And so wanting to include, funny sayings to give people a laugh, because sometimes that's the kind of support that we're looking for in these types of situations as well. And so then from that, we debriefed, we incorporated a lot of feedback and information. And then like Meredith said, we went back and forth, and did some like revisions to the library with the National Cancer Institute and that group, and working with the tech side of things to make sure that we were able to have the messages in the right length and all the technical sort of things. And we worked through that. And so then we were able to come up with a good tailored library. And so then we were ready to actually move into, getting end user feedback and reactions to that. And so we did that in multiple different steps and engaged with people in a variety of different ways. The first was in-depth one-on-one interviews, where we recruited participants to, do an interview where we went through a variety of different messages to get their reactions and thoughts on the content and wording that was going to be included in the library, and just making sure, like, is this relevant, appropriate? Do you like the way that it's phrased, the tone, a variety of different questions. Similarly, then, we did some updates and revisions based on that feedback. And then we held a focus group, to evaluate messages as well in a revised library to see if it would, align with people's cultural values, practices, protocols, and if they felt like, this content is relevant and appropriate for me as a Native or American Indian or Alaska Native person who's looking to quit smoking. And then again, revise the library, and we were had a whole new library again. And then we started to do some beta testing where we had participants sign up for the program and go through the full program, the full 6 to 8 week program, and then did an interview at the end with them to get feedback about what it was like to go through that program, and experience it, and see how we needed to change things or adapt things further. So then here's some examples of what our primary tailored library look like. So in the first column, on the left-hand side, I guess, is the original version that came from the primary library, and then how we adapted that. So in the original, it was try this, take 10 deep breaths when you feel stressed or emotional this week. Check in with your craving level when you're done. And then the tailored version of that we had was, your breath is sacred. Take 10 deep breaths when you feel stressed or emotional this week. Check in with your craving level when you're done. The other example, oops, that has the same one on there. So I'll go to the next one here. And so these show the keyword examples of our mind, honor, and connect. And so again, sometimes there was a tailored version of this, and other times, it was just the content information that we wanted to make sure that we covered in these keyword messages. So for mind, we had mindfulness is an Indigenous practice. Try activities like beading, weaving, and listening to traditional stories. Another one, reflect on this. Your true self keeps tobacco sacred. Your true self doesn't use commercial tobacco products. You're a non-smoker. And then your breath is sacred. Practice taking a few deep breaths and let go of any negative thoughts that are trying to control you. For honor, we had Mini Wachoni, water is life. keep water close to stay hydrated and help with cravings. Take a sip, want another tip, then you can reply honor for more. And then maybe you would get word of the day for sacred tobacco in Ojibwe is Asema. Reply honor for more. Land, water, animals, and people are all connected. We are all related. Your life is sacred. You belong here. For the connect keyword, we had find out whose ancestral homelands you reside on, and then there's a link to where you could look. I think you can type in like your zip code or the place that you live and get more of that information. Work on building relationships with elders or knowledge holders and learn from their wisdom. And then lastly, traditional tobacco supports a good life and healthy community today and for future generations to come. So I think throughout all of these, again, another thing that we were trying to keep in mind is that that quitting commercial tobacco, in that habitual, non-sacred, non-ceremonial use, is not just about quitting that side of thing, or it's not just that quick decision to quit, but it's more about what is that longer or larger impact on your health and well-being, and how can we develop strategies that are going to help support you in getting there and staying quit, knowing that at the same time that it is a hard thing to do to quit commercial tobacco because of its addictive properties. And that just because there's a slip up here or there, you can still come back and do it again, and that there's still this whole community here to support you through that journey. We also wanted to mention that it was really an exciting update that we got when as we were developing this project, the President Biden had a few different meetings that are including our CEO, Melissa Buffalo. She participated in some of that, and they discussed this project. And so it was highlighted as part of the President's Cancer Moonshot Initiative. And so it was listed on the White House website as an opportunity as part of that initiative. So that was really exciting to get some of that national level recognition of some of the work that we're doing at ACAF in collaboration with a variety of different partners and entities who have helped to make this happen. I also wanted to show a couple examples as social media, or as I've done some engagement on social media. These are some of the promotions that have popped up on Facebook and what those have looked like. So it's been great to see that those are out there and that it's gaining some attention and traction there. And so as we continue to move forward, we'll continue to do the promotion of the program through social media. Those two screenshots that I had there are through the accounts for smokefree.gov, and at ACAF we'll continue to help promote those social media messages as well as developing our own. And then we are interested in providing additional opportunities for tailored webinars or presentations for specific audiences, because right now we know that the participants that we have here come from very diverse backgrounds and different types of roles or reasons why this is an interesting project. And so we started with wanting to do this as part of the launch and promotion, but we know that effective integration of this includes more of that tailored engagement with the people that have those strong relationships with the users who are looking to quit smoking. And so part of, I think what we're interested in hearing from you all is what ways, what tools or resources would be helpful for you to take this program and implement it in the work that you do, whether you're a, primary care provider or a nurse or, you know, a tobacco treatment specialist, or maybe you're just like a community member and you have, you know, friends or relatives who are smokers, and you want to be able to have a conversation with them. Like, what sort of tools and resources would be helpful? So again, we could continue to do webinars or presentations on this. You know, we could develop resources or toolkits. Any of that, I think, guidance and direction is where we're looking to you all, so we have a good starting point in figuring out which methods or strategies we should prioritize with this program. So I think that some of what, if you have any of those thoughts or ideas, suggestions, feel free to put those in the chat. Or we can bring them up here as we move into our question and answer session. But with that, I will say Pidama Do. Thank you.
Thank you all so much. Thank you to our incredible panelists, Alberta, Meredith, Dana, and Wyatt, for just the deep dive into this. And as you all are formulating your questions, some of what Wyatt mentioned, I really wanted to summarize what we heard. We've went on a journey in hearing from Meredith about having a successful evidence-based programming that helps people quit using commercial tobacco. And in working with Native communities, it was really important to understand the context, being representative, having it accessible, as well as culturally aligned. We learned from Alberta about the distinction between traditional and commercial tobacco and the increased rates and risks that commercial tobacco uses as it relates to cancer and other death and disease rates. We learned the importance of relationships from Dana and learning that it is imperative to understand the reasons for wanting to quit commercial tobacco, that cultural values are inherent to supporting people in their quit journey. Their connections to their families and their reasons for quitting are so important to acknowledge. We also know that breaking down these barriers and understanding the worldviews as a foundation in creating this culturally tailored program is essential. Wyatt continued to elaborate that Native communities have the wisdom to find the solutions and really took us into a deep dive of all of the steps to ensure representation in creating this program. He talked about even, you know, the words and humor. And when you think about working in all of this, language matters, context matters, and also framing it from an assets-based approach. Because we already know, right? People who are using commercial tobacco, they're going through their own journey and quitting. You know, we're not here to shame. And so how do we approach this in a more positive based way? You know, just understanding through all of this, through all of the journey, that we all belong here, that we are a part of this movement in helping people quit using commercial tobacco. And we really want to see our relatives thriving and our communities thriving and living in a good way. You know, so I think, you know, honoring all of the people that have brought their wisdom, their expertise, from all of the different program collaborations, to a lot of the, you know, community advisory committee, you know, and thinking about, you know, the ancestors that held on to these teachings that we are able to carry into this programming is all part of this big circle that we're, you know, in together. And all of you who joined us today, you know, are a part of that circle where you're wanting to see change. So with that, we're going to turn it over to anybody who has some questions, thoughts, feedback for our panelists. We have a message from Patricia that they love the use of humor, which can have a healing effect. Thank you so much for this outstanding presentation. I had seen earlier too from Tony Astron from the New York State Quit Line. They're the organization's public information specialist, and they're planning to promote the Smoke Free Native in their quarterly newsletter next week. So that's exciting. Thank you. Are there any other thoughts or questions at this time? Dr. Choi said, wonderful work. Thanks for doing it. And if you may not have your question or thought right now, you know, our wonderful group of panelists, their contact information, we can get that all to you to reach out and just learn more of the great work and behind the scenes that have happened. Cindy Fox Star says, thank you. All right. Well, excellent information. Just a lot of applause for you all. So as we are closing our time here, if there's one thing that you as panelists wanted to share with everybody joining today or people who will listen in, what is one thing that you would love for our community here to take away and bring into their work when they're talking about the Smoke-Free Native text? So I'm gonna toss it over to Alberta.
It's to the takeaway would be this is a wonderful text messaging program that was adapted for American Indian Alaska Native, and we definitely would want to for our participants to actually share it with others and link people who are ready to quit with this resource, and then also people who work in the communities and may know of a relative or our co-worker who are using tobacco, but just to go share this information with them to let them know that there is help available when they're ready. Back to you.
Thanks. I'm gonna pass it over to Meredith, Dana, and Wyatt to offer their insights too.
Thank you, Coco. I'll just say that I'll tag on to a little bit of what Alberta was saying just now. You know, I with the SmokefreeNATIVE program, you know, we have the national level efforts that we are undertaking in terms of, you know, using social media, earned media, also some paid media to help raise awareness of this resource. So that's a piece, and we recognize that. And you know, we would like to know, and when I say we, like the larger we of the whole group here, and you know, what sort of resources, like what can help get like raise further awareness about the program. So I'm sort of echoing what I'm, you know, what I'm hearing, and that's and how you know, NCI and IHS can be helpful in supporting that would be helpful.
Great. Yeah, I'll go next. So, you know, I think this program is just such a beautiful resource, and but I think it's really a part of like a bigger toolkit. And so, you know, I think there's a lot of communities that have been really working on this effort for decades. They might have, you know, in-person programming, you know, traditional tobacco movements. Certainly there are smoke-free policies. And, you know, this, I think, our thought was, you know, this will hopefully help for those that are seeking a text-based program, and just one more of the tools in the tool set. But even components of the program promote like reaching out to community, and there's some text in there that promote if it's of interest to reach out to a traditional healer. And so we really view this as like an interconnected resource with a greater system. On that note, I'll also promote a upcoming conference that might be of interest to folks. So we're having the second National Tribal Tobacco Conference in June, and I can't recall the exact dates. Maybe Coco or one of us can pop them in the chat. We held the last one in 2022, and we had leadership from tribal nations. We had some elders. We even had some youth. We had public health professionals, some researchers, allies at this conference. And there was over 300 people to share about, you know, efforts like this or efforts that have really been going on for much longer or new ideas. And so this once again will happen in June, and it will be again in Minneapolis, which is a beautiful, beautiful place in the summer. And so we hope to see you all there to learn more about this larger effort. And Wyatt.
And Wyatt, and then we have some more questions too.
Yeah, I would say I think, you know, definitely echoing the messages that others have already shared. In addition to that, I think especially for you know, the group of people that we intended this program to reach, is that, you know, there is a lot of support that is behind you to quit commercial tobacco and quit that, you know, habitual or recreational use. So while it is a hard journey, you know, keep going. And we're here to support you. And we also know that, you know, texting isn't for everyone, so we'll continue to find other opportunities and resource to engage with you in other ways as well. So keep an eye out for that and more to come.
Thank you all. We have some questions. So one is, this is semantic, but certainly words matter. Do Native Americans prefer the term nations versus tribes? I had heard that a few years ago from a Native American colleague and try to use nation instead of tribe in reference to particular communities. So I'm throwing it out to anybody who wants to answer.
It's a great question. So I'll also note that like this, you know, the terminology was definitely something that we discussed quite a bit within our project team and also with our community advisory board, because we know that, you know, there's a variety of different terms that relate to, you know, who we're referring to: American Indian, Alaska Native, Indigenous. You know, I think the general rule of thumb is to try to be as specific as possible. And I think the challenge, of course, with developing a national level resource is how to, you know, be able to represent something that, you know, lets those users know that this has, you know, that them in mind. And so we did ask questions about that to our CAB, but also to during our in-depth interviews, our focus group, and asked about that during like beta testing as well. And so when we came up with smoke-free native, like that was the best, most well accepted terminology that was used. And so like that's kind of what we went with for phrasing because it was most well accepted.
Yes, and I know we had a couple questions in terms of like the ancestral homelands and even the terminology. So I just put a link in the chat that you can find out more about the tribes that you may be working with, and just a little bit more of the background in terms of that. So thank you for that question. Our next question is, do you have social media content that we could use to promote Smoke-Free Native?
So right now, I would say ACAF is, you know, this is again something that we're looking for feedback on. If that would be helpful and useful, we could certainly work towards developing a social media toolkit with some, you know, template posts and language and some graphics around that. And so that will take a little bit of time to work with that, but we can certainly go in that direction if that's helpful. In the meantime, I know, again, there's the screenshots of the examples of the social media content that was posted by smokefree.gov. And Meredith, I don't know if you know of any other resources that are available to help with promotion from your side.
Those are really there's a social media, well, I guess we call it a social media toolkit that we had created for IHS and you showed some of the example posts from that. I mean, that's something that, you know, could be shared out. I mean, we've been sharing those posts. I mean, they are smokefree.gov branded. So I'm not entirely sure what people are looking for. I was making an assumption that they were looking for maybe some, you know, more like posts that they could brand themselves. And if that's the case, these wouldn't be helpful for that, but I certainly can share the social media toolkit that we used for the launch.
This is Alberta. IHS is going to develop some posters. So because that was a request that was made from some of our IHS clinics that in order to promote this and let people know this resource, it is best to go print some posters and in the clinic it can be hung up, and then so they'll be able to access the information. And then the other is we also wanted to go use the radio to make announcement that this is a public service announcement that this services is available, and then also do a short video to go post in the Good Health TV. So the the patients who are waiting in the waiting room will be able to go find about these resources.
Thank you. We had some, Deborah say, hopefully there'll be traditional tobacco farms on all 574 tribes. Dr. Choi would like to know, what is ACAF's plan to further incorporate Indigenous knowledge on broader cancer prevention?
Fantastic question. I think that definitely goes to, one of our taglines that we have, which is um, healing with culture. I think while we are the American Indian Cancer Foundation, I think that there's a lot of ways in which we go back to our Indigenous knowledge systems and really embrace those and culture and everything that we do. For us as Indigenous people, it just seems like that's how we live already. It's a way of life, and so the closer that we can get back to some of those things, we know it's not going to cure just cancer but many other health issues, and really embrace health and well-being in the communities that we serve. And so I think to me that it makes sense on a daily basis of just like doing the work in a way that makes sense for our communities. And I think what we're trying to do is be able to talk more and show examples of what that looks like. And I think sometimes it's just a little more challenging to communicate some of those things to non-native or non-Indigenous people who may have not grown up with some of those things. Because for me, like, all of this is based on my entire life experience, and that can be really challenging to be able to communicate in a brief period of time. But I think we at ACAF are trying to do a better job of like talking about that through storytelling, really. And I feel like that's what we're doing here.
Yeah, yeah. And adding on to that tagline that Wyatt was saying is really, we are reclaiming our Indigenous health through a variety of these mechanisms and the programming, and really focusing on those cultural foundational values as we create change. So, all right, we have a couple minutes left. Deborah McCall said placing materials in the MCRC, if applicable, would make them widely available. Just something for us to consider. So thank you for that recommendation. All right. Well, I think we are coming to close our virtual circle together. Thank you so much for your amazing wisdom, time, and energy, and just, the incredible teamwork that it took to, create this project. And I feel like it was at a lightning speed when Meredith said that. It was like, yeah, it was a fast and furious in creating the library with all of the relationships. And when you get a team of dedicated people to come together in Minnesota in January, that just proves and speaks volumes to, the belief in this work. So thank you all so much again for being with us. Thank you to all of those who joined us. And we hope that this is just the beginning as we're continuing to honor traditional tobacco and helping our relatives quit using commercial tobacco. So with that, we wish you all a magical day. And until we're all together again, take care.